It often begins as a small, seemingly insignificant discomfort, perhaps a dull ache in your back or a slight burning sensation when you move. You might dismiss it, thinking it's just a result of a long day or a minor strain. But as time goes on, that little ache starts to grow, becoming harder to ignore. It disrupts your daily routine, making even simple tasks feel challenging. You might start to wonder if there's more to it, especially as new symptoms appear, catching you off guard. These subtle everyday pains can sometimes be our body's way of signaling that something isn't right. What may seem like minor annoyances could actually be early warning signs of more serious health issues. In this video, we'll explore 7 types of pain that might be indicators of underlying diseases, helping you recognize when it's time to pay closer attention to what your body is trying to tell you. Chest pain. Chest pain can be alarming, and it's easy to brush it off as something minor like a pulled muscle or indigestion. But this discomfort shouldn't be taken lightly, as it can be a warning sign of a more serious underlying issue. Imagine waking up one morning with a tight, squeezing sensation in your chest. It might just be due to poor sleep posture or dehydration, but what if it's more? When your heart is under strain, it can affect the surrounding blood vessels, leading to chest pain that might signal something far more dangerous, like a heart attack. High blood pressure, stress, or even built-up mucus in your chest can increase the pressure on your heart, causing it to work overtime. If this pressure becomes too much, the heart might falter, leading to a heart attack. That's why chest pain, especially when accompanied by shortness of breath, sweating, or dizziness, should never be ignored. It's crucial to seek medical attention immediately, as it could be the difference between catching a serious condition early or facing a life-threatening situation. Painful breathing or shortness of breath. Shortness of breath can be unsettling and often occurs after strenuous exercise, extreme temperatures, or when dealing with obesity or high altitudes. While these factors can temporarily make breathing feel labored, unexplained or sudden shortness of breath, especially if it's severe, could signal a more serious health issue that needs immediate attention. Conditions such as chronic obstructive pulmonary disease or COPD, bronchitis, asthma, or pneumonia can cause ongoing breathlessness. Another serious concern is a blood clot in the lung, known as pulmonary embolism, which can be life-threatening. Heart problems and other lung issues might also lead to difficulty breathing. Additionally, a panic attack, characterized by a sudden onset of intense anxiety, can trigger severe physical reactions, including shortness of breath, even though there's no immediate threat. If you experience sudden or unexplained breathlessness, it's crucial to seek emergency medical care to identify and address the underlying cause, ensuring your health and safety. Severe headaches. A severe headache can feel like a relentless storm raging inside your head, disrupting your ability to focus and function. While headaches can stem from various sources like stress, tension, or even a common cold, when the pain is intense and persistent, it may be a sign of something more serious. Imagine waking up with an excruciating headache that seems to get worse as the day goes on. It might be accompanied by symptoms like dizziness, nausea, or sensitivity to light. Severe headaches can be a result of conditions like migraines, where the pain is often throbbing and intense, or they could signal a more urgent issue like high blood pressure, which puts extra strain on blood vessels in your head. In some cases, headaches could indicate carbon monoxide poisoning or a brain aneurysm, especially if the pain is sudden and severe. If you find yourself battling a headache that doesn't subside or worsens over time, it's essential to seek medical attention promptly. Addressing the root cause early on can help prevent further complications and provide relief from the debilitating pain. Lower back pain. Lower back pain is like an unexpected guest that lingers long after it's worn out its welcome. Imagine waking up one morning eager to start your day, but as you rise, a dull ache in your lower back pulls you back down. You might shrug it off, thinking it's just from lifting that heavy box yesterday or sitting too long at your desk, but the ache persists, slowly spreading, and before you know it, simple tasks like bending or twisting become challenges. You try to stretch it out, hoping to find relief, but it only seems to aggravate the pain. As days go by, this discomfort begins to interfere with your daily routine, making even the simplest movements feel like a chore. What started as a minor nuisance now demands attention, forcing you to wonder if it's something more serious, like a herniated disc or a sign of an underlying condition. Ignoring it is no longer an option. It's time to seek help before this unwelcome guest overstays its visit. Pain while urinating. Painful urination isn't just an uncomfortable inconvenience. It can signal a more serious health issue. Imagine rushing to the bathroom expecting relief, only to be met with a sharp, burning pain that makes you wince. While it might be tempting to brush it off as dehydration or a minor irritation, this type of pain can actually indicate something more concerning, such as a urinary tract infection or UTI, or a sexually transmitted disease or STD like gonorrhea. For men, this symptom is particularly worrying, as untreated infections can lead to complications like infertility or the spread of infection to other parts of the body. Ignoring it or hoping it'll resolve on its own can be risky. Instead, it's important to consult a doctor as soon as possible. With the right diagnosis and treatment, these conditions are often manageable or even curable, helping to prevent more serious health problems in the future. Don't overlook this symptom. It could be your body's way of telling you that something needs attention. Abdominal pain. Severe abdominal pain can be a serious indicator of an underlying health issue that requires immediate attention. When you experience a sudden, intense pain in your abdomen that doesn't subside, it's often more than just an upset stomach. This type of pain can signal conditions such as appendicitis, which typically starts near the belly button and shifts to the lower right side, often accompanied by nausea, vomiting, and fever. Other potential causes include kidney stones or liver problems, both of which can lead to significant discomfort. In some instances, severe abdominal pain might be due to bowel obstructions or internal injuries. It's important not to ignore this kind of pain or attempt to diagnose it on your own. Seeking medical attention promptly is crucial for identifying the cause and receiving appropriate treatment, which can prevent further complications and provide relief from the pain. Pain in toes. Pain in the toes might seem minor at first, but it can sometimes be a sign of a more serious underlying condition. This discomfort can arise from various causes, each requiring different approaches to treatment. Infections from untreated wounds or injuries can lead to swelling and pain in the toes, which, if not addressed, can damage surrounding tissues. Another common cause is gout, a type of arthritis that often affects the big toe. Gout occurs when uric acid crystals build up in the joints, leading to sudden, severe pain and redness. It can be exacerbated by consuming too much red meat or alcohol, which contributes to elevated uric acid levels. In addition to infections and gout, pain in the toes can also result from conditions like bunions or hammer toe, where deformities in the toe structure cause discomfort. It's important to pay attention to persistent or severe toe pain and seek medical advice to determine the exact cause and receive appropriate treatment. Addressing the issue early can prevent further complications and improve your overall comfort. Thank you for joining us in exploring these important health symptoms and what they might mean for your well-being. Recognizing and understanding these signs can be crucial in addressing potential health issues early on and seeking the right treatment. If you found this information helpful, don't forget to give us a thumbs up and subscribe to our channel for more insights and tips on maintaining your health. Share this video with friends and family who might benefit from it, and leave a comment below with any questions or experiences you'd like to share. Remember, paying attention to your body's signals and seeking timely medical advice can make all the difference in managing your health effectively. Stay informed and stay healthy.